Hello, everyone. Today we're going to be discussing how to effectively communicate with AIAN populations. We will look at some of the challenges and strategies and learn about how to develop and deploy skills that will help to build positive relationships with patients and impactfully collaborate with communities. The objectives for this presentation are demonstrate effective and culturally safe communication with Indigenous patients, identify features of overt, subtle, and structural racism or discrimination in interactions between patients and health professionals and systems, identify ways to address such occurrences, and acquire skills to advocate for their resolution, and demonstrate skills in effective consultation and collaboration with AIAN and other professionals and support resources. When communicating with American Indian and Alaskan Native patients, providers can face challenges including historical mistrust due to past abuses, cultural differences in communication styles, like storytelling instead of direct statements, potential discomfort with direct eye contact, reluctance to disclose personal information, and a need to understand and respect diverse tribal traditions and beliefs, which can vary significantly between different communities, all of which can hinder building trust and effective communication during medical consultations. Historical trauma. Many Native Americans have experienced historical trauma from colonization, leading to distrust of healthcare providers and a reluctance to share personal information. Cultural communication styles. Storytelling. Some Native Americans may prefer to explain their health concerns through storytelling rather than direct statements, which can be misinterpreted by providers. Nonverbal cues. Direct eye contact may be considered disrespectful in some cultures, and silence can be used to contemplate and process information. Lack of cultural awareness. Providers may not understand the nuances of different tribal cultures, potentially leading to misinterpretations of patient behavior or health concerns. Additional communication challenges providers can face include language barriers. Depending on the community, language barriers can exist, requiring the use of interpreters or culturally appropriate communication strategies. Stigma around mental health. Some Native American cultures may have different perspectives on mental health, leading to reluctance to discuss psychological issues. Concerns about research participation. Past research abuses on Native communities can lead to apprehension about participating in medical research. Also, providers need to understand how clients perceive their own cultural identity and how they view the role of traditional practices in treatment. To achieve effective and culturally safe communication with Indigenous patients, prioritize active listening, use simple language, avoid jargon, respect silences, involve family members when appropriate, ask open-ended questions, acknowledge their cultural identity, and be mindful of power dynamics by seeking their input and understanding their perspectives on health and treatment options. Consider utilizing culturally competent interpreters or community health workers when necessary. Respectful introductions. Greet patients with respect, introduce yourself clearly, and ask how they would like to be addressed. Active listening. Pay close attention to what the patient is saying, both verbally and nonverbally, and use reflective listening techniques to demonstrate understanding. Simple language and avoid jargon. Explain medical terms clearly and avoid using complex medical jargon that might be unfamiliar. Cultural understanding. Demonstrate awareness of the patient's cultural background, including their beliefs about health and illness, and respect their traditions. How to address these challenges? Build trust. Take time to establish rapport with patients, acknowledge their cultural background, and actively listen to their concerns. Ask open-ended questions. Encourage patients to share their experiences and perspectives using open-ended questions. Respect cultural practices. Learn about the specific cultural practices of the tribe the patient belongs to, and incorporate them into care when appropriate. Utilize cultural brokers. Consider involving community health workers or cultural brokers to facilitate communication and bridge cultural gaps. Seek cultural competency training. Healthcare providers should actively seek training on cultural competency to better understand the needs of American Indian and Alaskan Native patients. Be mindful of language. Avoid using jargon and explain medical terms clearly, ensuring patients understand the information. Family involvement. Ask about the patient's preferred level of family involvement in healthcare decisions and include family members when appropriate. Open-ended questions. Use open-ended questions to encourage the patient to share their experiences and concerns in their own words. Respectful silence. Understand that some Indigenous cultures value pauses in conversation, so don't rush to fill silences. Cultural sensitivity. Avoid making assumptions about the patient's beliefs or experiences based on their Indigenous identity. Community engagement. Consider collaborating with local Indigenous health workers or community leaders to better understand cultural nuances and access support when needed. Interpreter services. Utilize qualified interpreters when necessary to ensure effective communication, especially if the patient does not speak English fluently. Patient-centered care. Empower the patient by involving them in decision-making regarding their health care. Important considerations. Cultural diversity. Recognize that Indigenous cultures are diverse and vary across regions, so avoid making generalizations. Addressing historical trauma. Be mindful of the potential impact of historical trauma on Indigenous patients and approach sensitive topics with empathy. Self-reflection. Reflect on your own biases and cultural awareness to ensure you are providing culturally appropriate care. Racism and discrimination in interactions between American Indian and Alaskan Native patients and health professionals can manifest in various ways, including explicit, readily identifiable discriminatory behaviors like using racial slurs, refusing to treat a patient based on their race, or making overtly biased comments about a patient's race. Racism often stems from a lack of awareness or understanding of Native American cultures and historical trauma, leading to mistrust and poorer health outcomes for patients. Overt racism. Directly racist language. Using racial slurs or derogatory terms when addressing a patient. Refusal to treat a patient based on race. Explicitly stating unwillingness to provide care due to the patient's race. Making overtly biased comments. Expressing negative stereotypes about a patient's race during the consultation. Discriminatory body language. Avoiding eye contact, displaying discomfort or disinterest when interacting with a patient of color. Subtle racism manifests in microaggressions, like dismissing a patient's concerns due to racial stereotypes, interrupting frequently, or using patronizing language. Subtle racism microaggressions. Colorblind comments, statements like, "I don't see color," which dismiss the reality of racial experiences. Questioning a patient's intelligence based on race, assuming a patient of color may not understand medical terms due to their race. Assuming a patient's cultural background based on appearance, making assumptions about a patient's beliefs or practices without asking. Interrupting a patient frequently, not allowing a patient to fully express their concerns. Patronizing tone, talking down to a patient or using overly simple language. Structural racism refers to systemic inequalities within healthcare systems that disadvantage minority patients, such as unequal access to quality care, lack of culturally competent providers, and biased healthcare policies that disproportionately impact certain racial groups. Structural racism. Unequal access to quality care. Disparities in access to specialized care, lack of culturally competent providers in certain communities. Insurance disparities. Policies that limit access to care for minority patients due to socioeconomic factors linked to race. Clinical decision-making bias. Unconscious biases influencing treatment decisions based on a patient's race. Lack of diversity in healthcare workforce. Underrepresentation of minority healthcare providers leading to potential cultural gaps. Systemic data collection issues. Not tracking racial data to identify and address healthcare disparities. The impact of discrimination and racism on patient care causes patient hesitancy to seek care due to fear of being judged or disrespected by providers. Patients will often delay seeking care and avoid necessary medical treatment due to concerns about cultural insensitivity. Patients also have reduced engagement with treatment regimens due to lack of understanding or feeling unheard by providers. Some solutions to these situations include: develop cultural competency, gain knowledge about Native cultures, health beliefs, and practices. Seek patient input, actively engage patients to understand their unique needs and preferences. Employ culturally appropriate language and communication styles. Collaborate with tribal communities. Partner with Native leaders and organizations to ensure culturally relevant healthcare delivery. Advocate for systemic changes. Work to address broader healthcare disparities faced by Native populations. To establish effective consultation and collaboration with American Indians and Alaskan Natives, AIAN communities, and other professionals, focus on building respectful relationships, understanding cultural nuances, actively listening to community needs, engaging appropriate tribal leadership, and demonstrating a commitment to ongoing learning and adaptation through actions like conducting thorough cultural competency training, seeking guidance from tribal experts, incorporating culturally appropriate practices into your work, and prioritizing community input in decision-making processes, while also fostering strong partnerships with other relevant support organizations and professionals to ensure comprehensive care and address complex issues. Key elements to highlight: cultural awareness and respect. Learn about tribal history and sovereignty. Understand the unique history, culture, and political structures of the specific tribe you're working with. Use culturally appropriate language. Avoid stereotypes and generalizations, and be mindful of respectful terminology. Acknowledge and honor elders. Recognize the important role of elders in tribal communities and seek their input when appropriate. Be mindful of spiritual beliefs. Respect traditional practices and beliefs when discussing sensitive topics. Building relationships and trust. Establish initial contact through appropriate channels, reach out to tribal leadership or designated representatives to initiate collaboration. Practice active listening. Pay close attention to community concerns and perspectives. Be patient and flexible. Understand that building trust takes time and may require adapting to different communication styles. Demonstrate transparency and accountability. Clearly explain your goals, intentions, and decision-making process. Community engagement and consultation. Conduct community needs assessments. Involve community members in identifying key issues and priorities. Hold regular meetings and forums. Provide opportunities for open dialogue and feedback. Incorporate community input into program design. Ensure that interventions are culturally relevant and responsive to local needs. Provide culturally appropriate materials and information. Translate materials into relevant languages and consider cultural adaptations. Collaboration with other professionals. Identify key stakeholders. Partner with other organizations and professionals serving the AIAN community. Establish clear roles and responsibilities. Define how different parties will contribute to collaborative efforts. Coordinate services and referrals. Ensure seamless access to necessary support systems. Share knowledge and best practices. Collaborate to learn from each other and improve service delivery. Examples of demonstrating these skills: presenting a training on cultural competency for healthcare providers, specifically addressing the unique needs of AIAN patients. Facilitating a community forum to gather input on a new health program design, ensuring culturally appropriate language and respectful engagement. Partnering with tribal leaders to develop a culturally sensitive curriculum for a school program serving AIAN students. Seeking guidance from a tribal elder or cultural consultant to ensure accuracy and appropriateness in project development. Building relationships and trust. Establish initial contact through appropriate channels. Reach out to tribal leadership or designated representatives to initiate collaboration. Practice active listening. Pay close attention to community concerns and perspectives. Be patient and flexible. Understand that building trust takes time and may require adapting to different communication styles. Demonstrate transparency and accountability. Clearly explain your goals, intentions, and decision-making process. Community engagement and consultation. Conduct community needs assessments. Involve community members in identifying key issues and priorities. Hold regular meetings and forums. Provide opportunities for open dialogue and feedback. Incorporate community input into program design. Ensure that interventions are culturally relevant and responsive to local needs. Provide culturally appropriate materials and information. Translate materials into relevant languages and consider cultural adaptations. Collaboration with other professionals. Identify key stakeholders. Partner with other organizations and professionals serving the AIAN community. Establish clear roles and responsibilities. Define how different parties will contribute to collaborative efforts. Coordinate services and referrals. Ensure seamless access to necessary support systems. Share knowledge and best practices. Collaborate to learn from each other and improve service delivery. Examples of demonstrating these skills. Presenting a training on cultural competency for healthcare providers, specifically addressing the unique needs of AIAN patients. Facilitating a community forum to gather input on a new health program design, ensuring culturally appropriate language and respectful engagement. Partnering with tribal leaders to develop a culturally sensitive curriculum for a school program serving AIAN students. Seeking guidance from a tribal elder or cultural consultant to ensure accuracy and appropriateness in project development. When communicating with American Indian and Alaskan Native populations, key takeaways include respecting silence and pauses, avoiding direct eye contact as it can be perceived as disrespectful, understanding the importance of storytelling, and always acknowledging the diversity within tribal communities, ensuring you consult with the specific tribe or community to understand their customs and preferred communication methods before engaging. Key points to remember: nonverbal cues. Be mindful of body language, as direct eye contact may be seen as disrespectful in some communities. Storytelling emphasis. Understand that storytelling is a key part of Native communication, so incorporate narratives when sharing information. Avoid stereotypes. Do not assume all Native people are the same or use stereotypes in communication. Acknowledge history. Recognize the historical trauma experienced by Native communities and approach communication with sensitivity. Here are our resources. Thank you for listening to this presentation.